Welcome to Integrative Medicine Perspective. I'm Dr. Winnie Liu. A detailed step-by-step nutritional plan should be a part of an overall cancer care package. Recently, my colleagues and I published our research findings in the Journal of Clinical Oncology Practice. Our study primarily focused on whether using a dietary method to prevent one of the side effects of carboplatin chemotherapy, namely hypomagnesemia, meaning low magnesium levels, is a feasible approach. The results of the study showed that using a magnesium-rich diet to prevent such a side effect is not only feasible but also effective. So I will include the link to this article below for those who are interested in reading more. Today's focus is Table 1 in this article. This table serves as a guide for patients on how to select the foods to ensure adequate magnesium intake. I believe that this table not only provides guidance for patients undergoing chemotherapy, it can also help anyone ensure enough magnesium from their daily diets. But first, let's discuss why we advocate for a dietary approach rather than use magnesium supplements, especially when magnesium supplements are readily available and relatively inexpensive. There are several reasons for this. Firstly, platinum chemo agents can cause various electrolytes imbalances, with hypomagnesemia, meaning low magnesium levels, being the most common and severe. So simply supplementing magnesium cannot prevent all electrolyte imbalance side effects. Secondly, the absorption efficiency of magnesium supplements is very poor, only around 1/3. The unabsorbed magnesium acts as a laxative in the colon. When diarrhea occurs, more electrolytes and even proteins are lost, which can outweigh the benefits of magnesium supplementation. Magnesium from foods, however, is more easily absorbed. And foods offer a wide range of choices, which can be adjusted according to individual gastrointestinal condition, thereby avoiding side effects like chronic diarrhea or constipation. Thirdly, foods have the significant advantage of being more nutrient dense. With proper planning, multiple deficiencies can be addressed simultaneously. Now let's take a look at the information in this table on how it can be applied clinically and in our daily life. This table includes 5 categories of foods: beverages, nuts, vegetables, grains, and legumes. Yogurt is the only animal product listed here. Indeed, animal foods are not particularly rich in magnesium. A diet mainly consisting of animal products is prone to magnesium deficiency. This table not only lists the serving size of foods and their magnesium content, but also provides a specific guidance: at least 2 servings of whole grains, 2 servings of vegetables, and 1 serving of legumes per day. It is obvious in this table that hemp seeds are very high in magnesium, and consuming 5 to 6 tablespoons of hemp seeds per day is sufficient to meet magnesium needs. This method is certainly much easier and more convenient than the special guidance provided in this table. Why didn't the study solely rely on this simple and convenient method of using hemp seeds alone? The main reason is to ensure a complete and balanced intake of nutrients instead of satisfying magnesium requirements alone. The guidance of selecting various foods further ensures an adequate intake of multiple nutrients. By using hemp seeds alone, while it may satisfy magnesium requirements, its manganese content is too high and calcium too low, among other weaknesses. Therefore, when using this table, it is important to pay attention to the variety of foods chosen. I recommend this table not only for its food selections, but also for its specific guidance on usage. In terms of nutrition, It is important to point out that this table does not satisfy all essential nutrient requirements. For instance, protein, vitamin B12, B6, and biotin may be insufficient, which would need to be supplemented with animal-derived foods. Building upon this table, adding eggs, meats, and a small amount fruits completes the intake of essential nutrients. Here, I will use an example from a previous video on magnesium-rich diets to illustrate. This is a meal plan for a day with the magnesium content of each food item marked. Let's take a look at the intake of other essential nutrients. Potassium is rich in spinach, bananas, lentils, tofu, broccoli, and green peas. Spinach and tofu are high in calcium. Others fairly rich in calcium include lentils, broccoli, and green peas. Clearly, eggs and chicken provide relatively deficient nutrients in plant-based foods such as protein, B12, B6, and biotin. I hope this table I introduced today will be helpful for planning daily diets. By using this table along with a moderate amount of eggs, meat, and fruits, it is not difficult to achieve a complete and balanced intake of nutrients. Finally, who may encounter problems when using such a table? One group includes those with digestive disorders, such as slow gastrointestinal motility, irritable bowel syndrome, etc. Another group involves individuals with impaired kidney functions, since the kidneys play a crucial role in electrolyte balance. Processing diets rich in electrolytes, like the one in the table, can be challenging for insufficient kidney function. If you do have digestive or kidney function issues, it is best for you to consult your doctor or nutritionist to determine how to select the foods from this table based on your physiological characteristics to achieve nutritional goals and at the same time avoid digestive problems or electrolyte imbalances. That's all for today's discussion. Please leave comments and questions. I will see you next time.